A cluster of 9 polyclinics will be the first in Singapore to offer teens mental health screening for conditions like insomnia, depression and anxiety. Nearly 100 aged between 13 and 17 years old have benefited so far. Now, the National Healthcare Group Polyclinics says it will help with early detection and support. For more on this new program, we speak with Dr. Eugene Chua, family physician and associate consultant. Dr. Chua, thank you so much for joining us today.
Thank you so much for having me here today.
So first of all, how are these teenagers referred to you? Can they just walk into any of the polyclinics and request for a mental health screening?
Right. So Alert is a youth mental health service that is dedicated to youth 13 to 17 years old. Right? And this service is rolled out across all our 9 polyclinics. It comprises of a team of family physicians as well as medical social workers. And they provide opportunistic screening to youths who present to our clinic. And these youths may present to us with bodily symptoms, physical symptoms such as headache, chest pain, abdominal pain, or they may actually present with symptoms suggestive of depression, anxiety, and insomnia. So our family physicians would first assess the patients and rule out any medical conditions, and also explore if there are any potential risks, such as suicidal risks, self-harm behaviors, or any abuse, neglect, or any signs of bullying. Right? And if there are any psychosocial issues that are brought up, our medical social workers will step in to do a comprehensive psychosocial assessment, provide supportive counseling. And at the same time, we also engage the youth, families, and parents, right, to provide psychoeducation and also engage schools if necessary.
So it sounds like a comprehensive program. You talked about the conditions like some of the common conditions like insomnia, depression, and anxiety. What are the root causes of most of these conditions, and how are doctors treating them specifically?
Right. So we understand that youth is a period which is very vulnerable. Right. They're undergoing a lot of changes. So puberty and through the bodily changes, social dynamic changes as they go through the various school phases, and as well as psychological changes as they foster their own identity, seek independence, but yet at the same time seek acceptance from their peers. This is an exciting period of growth, but it can also be very challenging for some, and this may become some element of stresses for them, right? And when youth present with these issues, right, it provides an opportunity for us to talk to them, right, to understand what are their struggles, right? And as family physicians, we provide the holistic care, right, to identify these stresses. At the same time, also, if there are any medical conditions, we would like to address them, and that's where our social workers also come in to provide that comprehensive psychosocial support.
Okay, and many of these young people, I assume, particularly those with self-stigma, you know, they worry about how their mental health conditions can impact their career or their future. So do these disorders or prescriptions go in their medical records, or will it have some sort of effect on their professional lives at a later stage?
Right. So medical records are kept strictly confidential and will never be released to any third party without the patient's explicit consent. And on the topic on a mental health declaration, just recently, Ministry of Manpower led the Tripartite Alliance made the declaration, right, that the act of an employer asking for potential applicants to declare their mental health conditions is considered discriminatory and strongly discouraged.
Okay, so for those future employers, they're basically not allowed to ask for these medical records at all.
To.
Okay, so as much as we've progressed in acknowledging our mental health conditions, you know, the stigma surrounding it and the negative labels tagged to it, they still exist to a certain extent, right? So how serious is the issue of mental health, especially among our young ones, and how is it being perceived here in Singapore?
And that's a very important question, and that's why we are very encouraged to be here to share more about our youth mental health service, because we want to provide youth mental health service in an accessible way across all our polyclinics, right? With a stigma-free environment. We want to encourage youth to step forward, to share their struggles, and to seek the help that they need, right? And mental health issues amongst youth, it's becoming more and more serious. And I quote the year's study conducted by NUS that 1 in 10 youths, right, actually suffer from some mental disorders, and 1 in 3 through that study reported that they have internalizing symptoms such as depression, anxiety, and loneliness.
So only 9 polyclinics in northern and central part of Singapore currently have this service. Are there any plans to make this service more widely available across Singapore?
Right. So, like I shared earlier, youth is a period that's vulnerable. And I would like to quote Franklin Roosevelt, we shared that we cannot build a future for our youth, but we can build our youth for the future. And that's what Alert aims to do. We want to help young individuals one step at a time. And definitely we hope that this service will become easily accessible. And when a youth mental health service is easily accessible, it reduces the stigma and encourages youth to seek help. And that's why we really want more and more youth to know, and not only youth, but also their parents and caregivers, because they are in touch with their youth most often.
Dr. Chua, we appreciate your valuable insights. Thank you so much for speaking with us. That was Dr. Eugene Chua from NHG Polyclinics. Thank you.
Thank you.